Court.
Grand Rising Elizabeth. Today
Grand
we have a
Rising.
very interesting topic, and I want you guys to please help me welcome the incredible co-host, my incredible co-host, Deitra Covington, as we discuss this powerful topic of courage through the surgical journey. We
Ooh.
bring strength, compassion to this conversation, reminding us that even in difficult times or difficult moments, courage and healing are possible.
But
So,
thank you so
yeah,
much for that beautiful introduction.
you know,
I'm looking to share the screen and I can't for some reason.
I
Huh.
gave you I gave you the power.
Yeah, I guess that's not the issue. Oh, share. Maybe I should.
That might be the issue.
Right, right. Okay. All righty then. Okay, here we go. Let's see. Slideshow. Make it a little bigger. There we go. All right. Start from the beginning. Yay. Okay, can everyone see the title there?
Yeah.
Health and Wellness Show. Okay, great. And just thinking about the introduction, thank you so much, Sister Stacy or Nurse Stacy. Yay. Okay, courage through the surgical journey. Okay, you might ask, teacher, why'd you come up with this subject? That would be a good question because it's a little different from things I talked about in the past. But you know, being a health coach or advocate, I talk to a lot of people throughout the week, and I've been talking to folks, and they've been saying they're getting ready to go have surgery on a knee, on a arm, on a foot, on a something, but it's been a lot of talk about surgery. So I said, wow, let me look into this a little bit more. So that's why this subject has come up right now. Okay. Now, just in case you're thinking about surgery for anything, or you know someone that is, there's some questions people need to ask before they go to surgery. First of all, is it urgent? Because sometimes the doctors, they'll tell you quick, fast, in a hurry. You can get surgery, have surgery, because they make more money, of course, with surgery when you get it. But you got to really know if it's the best thing for you to do. So, can you reach your ideal body weight before surgery? That's important. Um, and sometimes you might not know what is my ideal body weight, but maybe that's something you should know actually. But if you can't reach it, the ideal, can you lose at least 10% of body weight before surgery? I don't know if this sounds strange to you all. Does it make sense?
it makes a lot of sense
Okay.
because you do have to take into account how much you weigh. If your weight is prohibiting you from doing things, especially if you have knee surgery or ankle surgery,
Yeah.
most of your weight bears on those weight bearing joints. So for you to have surgery and your weight is up there, it's going to take a little bit longer for you to recover.
Okay. Yeah. Thanks for sharing that. That's true. All right. So then we'll go to the next screen here. The key aspects of anesthesiology. And this is important too. You know, most surgeries you have to get, you have to get anesthesia. Um, but there are some issues with that if it's not done correctly. Um, so first of all, you have pre-operative care. I'm going to share a little bit about that because I didn't know all these things were happening. I never had surgery, so I don't know. I've never went through this per se, but I've heard about it. Well, first of all, perioperative care is when the anesthesiologist manages patient's care before, during, and after surgery, covering different assessments. it's a lot that they think about before you have surgery. I'm sure you all know this if you heard people prepare for surgery.
Yeah.
They have to go through a lot of things because sometimes you can't have surgery if some things aren't in place. Then you have types of anesthesia, general anesthesia, introducing temporary unconscious to make patients aware of pain. Inducing temporary unconsciousness to make patients unaware of pain. And that's very interesting to even read that part of it because becoming unconscious, they want you to be unconscious. They're going to prepare you for that. Can you imagine? They're preparing you to go out, so that's general. And then you have regional anesthesia is numbing specific areas of the body. So that's important. You can understand that, And the sedation, administering medication for relaxation during the procedure. So it's interesting how they really put the body down. So you don't feel anything. But they're cutting, they're doing something to the body that if you felt it, you would be like out of your mind, more or less. Right. So this is important. And then you have pain management, providing comprehensive pain management, including chronic or acute pain, control following the procedure. And that will come in importantly. I mean, that would be truly important because if they've been cutting on your leg, your knee, your arm, your whatever, that pain is going to be there because it takes time to heal. And then we have critical care management, where anesthesiologists are essential in ensuring that patients remain stable throughout surgical interventions, providing expert care to manage potential complications. So there can be some complications when you getting ready when they're preparing you for surgery or they starting to cut on you or whatever. It can be some complications. So the anesthesiologist is going to be there to help you out. Any comments so far?
Yeah, it's important. I'm glad you're bringing this up because, even in perioperative and all of these different kind of things that they do, in some situations, people have to go in what they call emergency surgery.
Yeah.
My husband has been into emergency surgery on 2 occasions.
Oh,
and
wow.
so
Okay.
in those situations, you don't have time to prepare yourself
Okay.
for anything before they do the surgery because the surgery is an emergency. And the critical care management tool after the surgery is very, very important because right after that, depending on what you went in there for or what the emergency was, they have to make sure that they decide on whether or not you can go on a general floor or you need to go to intensive ICU.
I see. Okay.
The intensive care unit in order for them to, make sure that you're getting the proper care because on the other floors, those nurses might have anywhere from 5 to 10 patients, whereas critical care, you may have 1 or 2 patients. So
Okay.
they get to manage you more carefully. But yeah.
Oh, wow. Interesting.
Yeah. Yeah. I had a surgery on my knee one time and I woke up just on the anesthesiology part. I woke up in excruciating pain.
Oh, wow.
Well, the guy next to me was chilling when he woke up. I'm like, where's my pain medicine? It felt like somebody took a shotgun and blew my knee out.
Oh, wow.
They did not take care of me to make sure that when I woke up, I didn't feel nothing. And I had to cry for over an hour to get them to give me something. I'm like, why did y'all do me like that? To me, that was not good perioperative care.
Not at
making
all.
sure that I woke up. Wake you up and see if you're gonna wake up, and then don't even. I wake up and I'm like, what the heck
I
happened
know.
to
That's
me? And I would have been
horrible.
gone through the surgery. It was terrible.
Well, I'm glad you made it through it. All right. Now you have a surgical team, and this is an important team because they're gonna take a look at all the different levels, oxygen, blood pressure, and peri-intubation. And that was a big title. I wasn't quite sure about that one, but that's important because they have to make sure that they're gonna place a tube in your throat to make sure it's gonna go in your windpipe to make sure that you have an open airway and and they can deliver oxygen when it's needed and to protect your lungs from aspiration. I'm familiar with this intubation issue because my sister had asthma, and when she had an attack, they had to intubate her, and so sometimes we would be there, we would see them go through the procedure and intubate her. She didn't like it at all. It was horrible for her, but she needed to have it done to make sure that air was coming to her so she can breathe. But yeah, so it just showed me the seriousness of getting an operation. I don't know if it happens for every operation. They have to do that intubation, or do you know, Stacy?
No, they don't have to do intubation for every operation.
Okay. Yeah.
It just depends on the function of the lung capacity or how your lungs are before you go in there.
Right.
If you think you're going to need to be intubated when you come out of surgery, then they do that because most people that get intubated also get knocked out. Like they stay asleep for a long period of time.
Okay.
Because they need their bodies to rest. They don't need them to wake up because in intubation, if you wake up while you're intubated, you're going to be all over the place, like trying to get this out of
your you're going to want to fight it off.
You're going to feel like you can't breathe because you're on this intubation. What do they call it? It's a breathing machine. The intubation means that the machine does the breathing for you.
Okay.
So if you wake up and you get frantic, you'll start breathing erratically, and the machine can't do what it's designed to do. And so they really can't take you off of intubation or the ventilator is what I'm trying to say.
Ventilator, yeah.
Until you are actually able to breathe above the vent, because they're going to put you on some numbers, and the numbers have to stay at a certain time till your body is able to breathe above that. So when you're able to breathe above that, that's when they decide to take intubation out. So people that are critically, their lungs are at risk and they have to relax.
Thank you for sharing that, giving more explanation for that intubation process. Because it's important though, especially when you need it, I guess.
Yeah. It's a paralysis medication that they give you to sedate you.
Oh, wow.
So not only are you just sedated, you can't move. You like that.
Isn't that something that's scary?
Yeah. It's scary, but it's needful.
Yeah, I can understand that truly.
Because some people, like I said, they'll wake up and they'll be frantic and they pull that tube out and they're a goner.
Yeah.
Because they can't breathe. You can't be pulling the tube out when you can't breathe. Because at that point, it's going to be hard for them to get that tube back in.
Ooh-wee, I know that's right.
Yeah.
Okay, personally preparing for surgery. The things that stood out for me in preparing this was check your numbers. We talked about numbers last week, I think we did, or the week before. But it's important to know your numbers. I mean, your blood pressure, your blood glucose level, whatever. But you want to be in stable health as much as you can be before surgery, because surgery is going to take some things from you. I mean, it's not an easy process for the body. So you want to be as healthy as you can before even going into surgery. One thing for sure we can look at is blood pressure. Because believe me, they gonna check it at the hospital or whatever before surgery. And if your blood pressure is not right, they're not gonna take you under. I mean, surgery and anesthesia and all that. They're gonna say no, you gotta get that straightened out. Or your blood sugars. That's important too. Um, to make sure our glucose levels are decent before surgery. Because once again, when the body starts going through getting cut, it's stress. It gets stressed. The body is stressed. And we want to make sure that, that stress doesn't take you even in deeper trouble than you already are with your issue. Any comments?
Yeah, I know for people who have, I've had some clients injured in motor vehicle accidents who have diabetes. And they needed surgery like spinal surgery, neck surgery on the back, lower back, or whatever, even on the shoulders and knees or whatever. But if their hemoglobin is not in the right range, they won't do the surgery.
Okay.
Because they'll tell them, like if they had 11 or 10.5 or something, they say you have to get below 7 before we do the surgery.
Okay.
Because the body is not able to heal properly when the blood sugars are high.
Okay.
And for blood pressures, sometimes they will go ahead and do it, like especially if somebody's blood pressure is high, they'll give them medication for blood pressure.
Oh.
And if it's low, they'll give you fluids to raise your blood pressure. So there's ways that they could tweak things with the blood pressure issue in the emergency situation. But usually, if you're going in for surgery, they will ask you to watch your blood pressure. So they'll take your blood pressure before they take you back and make sure that it's at a good range. Because once they start doing surgery on you, if you have high blood pressure, I think your blood pressure gonna go down. So it might go up because of the stress, but because of the blood loss that you get when you're in surgery,
that's right. That's right.
Yeah.
Wow. Okay. Let me see here. Ooh, on the day of surgery. That's a big day. You want to definitely follow all instructions from the surgical team. That's important because they want to make sure that they tell you what's needed to do, and they can make sure things go well as possible, right? I just want to list some of the things they say, and it sounds so familiar because I've had people in my family that had surgery, and I remember them going through these different things. I'm going to list them. Dietary restrictions, generally nothing to eat or drink after midnight before the surgery, including water, gum, or mints to prevent aspiration during anesthesia. Some protocols allow clear fluids up to 2 hours before arrival, but this must be confirmed by your doctor. The next thing is medication management. Take only medication approved by your anesthesiologist on the morning of surgery with a tiny sip of water. Hygiene. Shower with an antibacterial soap, usually the night before or the morning of the surgery, to reduce the risk of infection. Smoking and alcohol. Do not smoke or consume alcohol for at least 24 hours prior to surgery. Personal items. Do not wear makeup, nail polish, hairpins, hairspray, or jewelry, including body piercings, as those can interfere with equipment or monitoring. Valuables. Leave all valuables such as jewelry and large amounts of cash at home. Because as we spoke about previously, you're going to be down and out. You're not going to know what's going on and who's doing what to your stuff. So if you can leave a lot of valuables at home, that would be great. Arrival prep. Bring a photo ID, insurance card, a list of your current medications, and a case of glasses, dentures, or hearing aids. Oh, yeah. So that's something to think about, just to have those things available after surgery. Transportation. A reasonable adult must drive you home, and for many surgeries, stay with you for the first 24 hours. That's something to think about. And skincare. Do not shave the surgical site, as this can increase infection risk. Okay, that's something to think about too. Those are listed the 9 things that the surgical team would share with you. And then, as we go through our days, we daily document key numbers, blood pressure, glyc blood sugars. And you can have a little log. I know I have a log. Some people maybe have a log that you should bring with you to share with your surgical team or someone who's going to be operating on you, so they'll know. Stay calm and rested, which sounds really like, really, are you serious? But I guess it's important if you can, because sometimes thinking about surgery, it can be pretty get your mind going. I don't know. Anybody anybody have any comments on having surgery? Has anyone on the call had? I know you have, Stacy, but anybody else have surgery?
I had a DNC like 20 years ago,
Okay.
but realize that all this played a role, played into
I
everything.
know we don't know. We
Like,
don't
it's like,
know.
it's like, wow, okay. I just remember that anesthesia took forever. It seemed like it took forever to leave my body. Like, it just, you feel differently coming up under. And
Yeah.
so it took a couple of days where I just didn't feel right, you know what I'm saying, until that anesthesia left. So
Okay.
I remember that. It's like I didn't like that feeling.
I'm sure you didn't know. Well, thanks for sharing that.
Yeah, yeah, for me, when I had the hysterectomy,
Uh,
um, and they had me under for years after that, I was like totally my arms, my shoulders, um, were in a lot of discomfort. And I just
okay.
and I'm saying that because when you're knocked out, I mean, just like they open you up and they put their hand all inside of you, whatever they're doing. But I'm
Uh-huh.
just so sure that they reached over me, and like moved me or something, or was reaching over on my arms and stuff. Because
Uh-huh.
for a long time, it took a long time for that to heal. It wasn't like in distress, but I
Uh-huh.
knew that somebody that they had reached over me or moved me, and figuring I'm out, so
Right.
yeah, and then didn't realize how that was going to affect me afterwards. But it was years.
Oh,
It was years before my body, my arms, not my arms, my shoulders. Yeah.
shoulders. Mhm.
Yeah, I could just picture them reaching over me or moving me.
But it's interesting you still remember that though.
No, it's the memory is the pain afterwards. It's not that
Okay.
that I saw them do that, but I just know that that must have been what had happened because when I went in, I didn't have that,
Uh-huh.
and then for years that was very discomforting. And I just could imagine that that's what they did, because you're knocked out. You don't know
Right.
anything.
Right.
And they, when you see shows and stuff, you can see how they're moving you and,
Yeah.
just pushing you over and stuff like
Yeah,
that.
because you can't feel it, really.
Yeah, until afterwards.
Right. Well, thanks for
Hmm.
sharing that.
Hmm.
Look, hey everyone. But yeah,
Hey.
about the anesthesia. That was actually the first job I've ever wanted to do when I was 12. I severed my Achilles tendon. I had to have a
Ooh,
6.5 hour surgery. They had to pull some of my calf down. I had to go for 40 stitches, cast, all of that. But yeah, just sharing that. The anesthesia, if you guys know too, I don't want to veer off subject,
no,
but that
you're
all
not.
because it actually kind of like I'm in neurology now, like that's my number one goal. I want to learn all about it. But anesthesia, it actually takes a toll on your brain too. Like it
Yes, it
opens
does.
up certain synapses to make certain things connect in there. But it's a little different. But I don't want to veer off subject. But hey, everybody.
Hey, this is my niece. But
Hey.
no, no, no. You were right on target, honey, because that's what effect on the brain with
Hmm.
anesthesiology and all that. I've learned
Yep.
a little bit about that in studying this subject. I'm like, it's amazing.
Mm-hmm.
We got to be so careful, you know?
And
Is
even
it?
with the surgery, with my mom having a diverticulitis, she had to get 6.5 inches of her colon taken out.
Mhm.
And yeah, for staying there the first 24 hours, I think it had to be like, I can't even think of exactly how many hours, but my brother, sister, and I, we were all at the hospital. But when he came out, he was like, I'm so happy there's someone here because I didn't know if your
Oh,
mom was vain or not because her scar was going to be long. But it's like just little tiny things are extremely important to have someone there.
that's
But
so
that was
true. Mm-mm-mm. No, thanks for sharing.
no problem.
Ooh, wee. Okay. Anyone else?
No, just that from my understanding, that's one of the most important parts of the surgery. You know, for
Mhm.
that to be done right, because sometimes you'll hear them saying, she's coming out," you know.
Right.
Yeah, yeah. And when I had my teeth removed, they did not, they did the second one, I think, where they just numb it. You know, they
Mhm.
gave me something to, oh God, that was treacherous. Uh, if you have to do that, go under.
Right, right,
Ooh,
right.
go
Yeah.
under. Yeah.
'Cause you don't want to feel it. Mm.
Yeah. And you don't want to see it either.
Right,
You
right.
got a hammer. I mean, at one point they had to have a hammer at coming at you. Yeah.
Right.
Yeah. Yeah.
Yeah,
That
I can
sounds pretty
agree.
Oh,
traumatizing.
girl.
Right. Okay, let me go to the next screen. Thank you all for sharing things. Okay, post-op. So some things you got to prepare for in the follow-up of surgery. Let's see, home preparation and safety. You need accessibility. You got to set up a recovery space, such as a comfortable chair or bed, with essentials: phone, charger, water, snacks, meds within easy reach. So these things got to be set up before you go through operation and come home, if you can manage. Safety measures: remove tripping hazards like rugs and install non-slip mats in the bathroom, if you can walk around it even. Support system: arrange for someone to assist with cooking, cleaning, and transportation, especially during the first few days, because it'll be hard for you to get around, after surgery sometimes. Physical care and recovery. Incision management: keep wounds clean and dry to prevent infection, washing hands thoroughly before touching the area. Movement: engage in gentle, doctor-approved activity or walking to prevent blood clots and improve circulation. Pain management: take pain medication as prescribed, staying ahead of pain rather than waiting for it to become severe. And I've seen that to be the truth. Sometimes you have to take things before the pain hits, because you don't want it to really hit, because you don't want to feel it. Swelling reduction: use ice packs. One thing I read is ice will be your best friend after surgery. It's good to have you some ice around, ice pack. And elevation: If you dealing with your legs, you want to elevate them. Health and nutrition. Hydration diet. Drink plenty of fluids and maintain a high fiber, nutrient-rich diet to manage constipation and support healing. Rest. Give your body significant time to heal, allowing for plenty of naps. Yay, naps are cool. I like naps. I ain't had surgery, but I still like naps. Avoid irritants. Avoid smoking and alcohol, as they can delay healing. So that's important. But we can do it. We can avoid, I guess. I don't smoke or drink, so I'm like, okay, easy for me to say, I guess. Warning signs and follow-up. When to call a doctor? Immediately contact a doctor for fever, chills, unusual discharge, or odor from the incision, increased pain or swelling. Appointments. Attend all scheduled follow-up appointments. Mental and emotional health. Be patient with the recovery pace and manage expectations for when you can return to normal activities. Understand it may take time. And activities have. Prepare books, movies, or hobbies to occupy your time while resting. That sounds wonderful. Any comments?
I know after I had the hysterectomy, that was, well, it was six weeks.
Oh, wow. Okay.
I created my entire business plan.
Oh, wow. Good. You had time to do it, huh?
Right. And I really just really one of the things is vanity was a big word because um, when your body is going through something,
Uh-huh.
because at one point I went to the store and where you want to walk straight up, you want to walk and stuff, it does not matter. The body vanity it's not going to work because
Uh-huh.
my body was pulling me over so I could hold my stomach, from the
Oh.
surgery and stuff. So that's when I realized, okay, vanity.
Right.
When the body's in pain, it doesn't matter. It does not matter.
It does not. You're right. You're
Mm-mm.
right.
And then, just take the time to let the body heal. You got plenty of time. Just, sometimes you just want to rush on and get on about your day, about your life, and it's just not allow the body to heal. That's what I
Right.
want to
Exactly.
say.
It's gonna take time.
But I did the whole business plan from
That's
beginning
so
to end.
good.
And I didn't have Chat GPT either.
Right, you did. I'm old school. Right, right, right.
You
Yeah,
utilized your
right.
brain.
Hmm.
Yeah, what you shared, it reminded me of being pregnant and after having a baby. And then
Hmm.
you have to give yourself time to heal after giving birth. Because I had natural birth and it's very important. And sometimes you don't want to wait. You don't want to wait. I think it was a month or something afterward. You got to give your body time to heal because
Oh,
you want
no.
to get out there and do stuff. You're ready to go.
Ooh, Auntie, I commend you for that natural birth. I tried after 24 hours. I said, just give me an epidural. 35 hours of labor was good enough.
Oh
I
yeah, absolutely.
yeah, but
Absolutely. I was in labor about 4 hours. I said, "Oh, I could do this again."
ooh,
I
that would
didn't. I
be
didn't, but yeah, it wasn't that bad. But I do feel for you, Simone, that has to go through something like that. That is terrible.
yeah.
Yeah, look, it could be a lot worse. So
I
I
know that's
always
right.
look, I say happy birthday to everybody. If we opened up our eyes, literally, it's your birthday
It's
again.
birthday. I like that.
So
That's
happy
so nice.
birthday, everybody.
Hmm.
Happy birthday to you, honey.
Thank you.
Yeah, but anyway, just speaking on recovery and taking your time to heal. Because sometimes we don't realize that the body, like you said, Queen, the body it needs some time because sometimes surgery is pretty. It can be pretty heavy on the body, because it's cutting or doing something. You have to normally cut. Surgery is getting inside or something.
Mm-hmm.
So it takes time to bring the body back to homeostasis. Um, we have to give it that time to do it. It's not
Look, I'm
gonna
gonna
be
say,
saying, go ahead, Simone.
I'm sorry. Look, this is the last time,
No,
but
don't make it the last time. You all right.
that was something tremendously with any type of therapy, physical therapy. I love. I love any therapy, whether it's aromatherapy,
Mm-hmm.
throughout any of the five senses, any type of therapy. Every human body needs touch,
Yes,
all of
I
that.
like that.
And so, yeah, I'm a therapy girl. That's
You're a
all.
therapy girl. All right. Okay. That's
So
good.
what what
Glad
what did our what did our ancestors deal with? One, in Africa before being stolen,
right.
um, did they do the rest? Did they get that rest? Because I know when they was when we were stolen, right? They had to get right up and go back to work.
Right.
I wonder
Right.
what was the protocol when we were at home.
If your mother or your husband or your kids or somebody older than you was not there to help, you was on your own
Mm-hmm.
back in the day. Because just think about it, before surgery was even possible, women who had to have cesarean births actually died in childbirth if the baby didn't come out right, or
Right.
it's either the baby gonna come out right and you get up and keep it moving, or the baby's upside down, sideways, don't come out right, no interventions, because most of the people back then delivered at home.
That is you.
Doctors didn't come
Yeah,
to their
that's right.
houses and do stuff
And
like
as
long
and they
before.
used to stand, but they lay us down. Think of
Yeah,
gravity.
there was standing. There was more aftercare. The sisters of the village, when they say it takes a village,
Yeah.
there was more aftercare. You did go through your postpartum period. Most depends on the culture. Like, okay, depends on the culture. Like I know in Chinese culture, when a woman is pregnant, she don't do nothing. She is pampered. She's not expected to work. All she's expected to do is eat and just what is it? Produce that baby. And
Mm-hmm.
Right.
afterwards, I know aftercare, postpartum, you wrap up, you stay warm, you don't go outside. You're, there's, and there's pampering stuff that we don't get or we don't even talk about over here
Right.
in the States. I know in Haiti, there's a common postpartum bath that's done. Um, in protection of the mother and the baby. It's like the
Nice.
women of the village really pamper that new mother and that baby.
That's
Whether
wonderful.
it's cooking food, whether it's making sure the mom is okay, making sure the baby's okay. We don't have that postpartum support here in the
Right.
United States. It's like 6 weeks and you're done, but could be 12 weeks. It could be 24 weeks. It could
Right.
be a year, a year.
Right.
It's like we're expected to go back to work after 6 weeks. And it's like,
That's
that's
true.
not, there was a lot more care and more community and care when it came to, going through childbirth or even just going through surgery or something. You had more help
Mm-hmm.
and assistance in the body healing than what we do over here.
Yeah, I think that's something we all individually can really try to think about. When you know someone is pregnant, they're getting ready to have a baby, what can you do to assist that mother? I know back in the day, um, I did that and a mother, she was tired after giving birth and she asked me if I can come and watch the baby while she got some rest. So I
Mm-hmm.
stayed the whole day while she went to sleep and I watched the baby. So it's just little things like that.
Mm-hmm.
We can do little things for other people, our family, friends.
I think over in China, the reason why, and I may be totally wrong, that they initiate, like Danielle was saying, and having so much support for the woman after they have the baby, because over in China, you get one baby and that's it. You can't have another one. They have a
Now,
population control over there, unless
well,
they're
actually, they got rid of that. It's now
Oh,
up to
it's
two.
gone.
They got up to two now because they messed up with that population control.
yeah.
They have such a huge male population they don't have enough women over there to support the male population. So you have a huge population of men growing up without partners or
Wow.
even potential partners. And it's a very interesting situation over there. So I think they're up to like at least two or three now because they always say they wanted boys. So you could only have one child for one period of time. And if it wasn't a boy, then it was like shame on your family. But now you got too many men and not enough women it's a
Yeah.
situation over there.
I
Interesting.
remember women used to come to the United States just because they wanted more children because of the strict laws. I'm glad to hear they changed that because that
Yeah,
was
me
just
too.
like
Oh yeah, they
not right.
changed it. But like I said, they got a huge like men in their 40s, like late 30, between like 30, I think it's like 30, 40, 50.
Mm.
They're not married because there's not enough women
And
over
now
there to marry them.
Ain't
So
no women in the
I didn't
population.
say that it's not enough. It's
So there's
ew.
no more babies. Oh yeah. So that's weird. That's weird.
it
Wow.
is. It is.
Mm. Controlled population didn't work too well, huh?
It worked a little too well. A little too
Right.
In the opposite direction, but it didn't benefit the men, that's for sure. If they wanted a woman, that is.
Exactly.
but
Yeah,
they
that would cause them to lean towards one another. You know,
Oh,
yeah,
right.
that if yeah, it would seem, and I don't know if that's illegal in China, to be gay.
Right.
Yeah,
I
but
don't know because you don't hear of any gay rights or gay anything in relation to China.
hmm
Kind of
I think a lot of things are hush hush in China
well,
because
just like in Africa, it's a lot of stuff in Africa and Jamaica. It's definitely a hush no. But
right.
there is a population there. We know that, but it's not as freely broadcasted like
Yeah.
in America. It's like, yeah, we over here, we no.
yeah,
So
I know in Ibrahim Traore in Burkina, that was one of the things that it's illegal to be gay.
Yeah.
And they said that because they were going back to ancestors and how things were done,
Yeah.
and so they wanted to honor that as well. So you could actually go to jail. So if you want to be gay, or then you got to move somewhere else, because that's part of their um, law as it relates to going back to being community and having children and things like that. Now, I don't know what they say about like abortions and stuff. That wasn't brought up when they were talking about the different things, but that definitely was one. And that was the reasoning. The reasoning was around being like the ancestors to bring forth children.
Yes.
Now they have an overpopulation,
I
but
know.
when I think about that, I think about where the Bible said the more they were persecuted, the more they had babies, the more they grew, you know,
Right.
because then, you've been beaten and dogged out and stuff when you get home, and it's like, come on, baby, come on.
Right.
Yeah.
Comfort.
Where
And
they
then
say,
there's
let's
another
come
kid.
together as one, like we
Yes, right.
supposed to be.
So I just looked it up. It's not illegal to be gay in China or have consensual same-sex activity. However, you cannot marry the same sex. They will not
Oh,
allow you
okay.
that.
Okay. Mm-hmm.
They don't, even though it's not a crime, the LGBTQ people in China still face their limits. No legal recognition of same-sex couples.
Uh-huh.
Okay.
So you
Because we
can't get
went through
married,
that
no
here in America
recognition
at
of
one
that.
point.
Mm-hmm. They face
Isn't it in some states they still don't?
That's
Is it
possible.
from state to state that you can get married? Well, I don't know what's happening now.
it's legal in certain states to get married, and it's illegal in certain states.
Uh-huh.
I
Uh-huh.
don't know if they've did it across the United States or not. So the question would be is it legal to I'm going to ask ChatGPT, is it legal to marry in the entire United States someone of the opposite sex?
Right.
No, the same sex.
Oh, opposite. Oh, I'm sorry. Someone of the same sex.
Yeah.
Yeah, that was.
Look at that's deep. I'm gonna try to keep it short again. Like with me being as young as I am, I'm 37 and I'm a widow. And like I would never get married again. But it's like trying to take everything down to the root to have a piece of paper to signify or gratify the love that I have for this person who I'm just happy with. Yeah, the next person, whoever I get with, will have to be understanding of it. And that's a deep thing though, because a lot of people feel like they have to have a document or a piece of paper to get to
Right.
the root to express like we're human, we're supposed to be here loving each other, period. But that was just my opinion.
May
I'm
I
just,
ask
I'm,
without any judgment, I don't have no judgment around it. Why did you come to that place, to that point? If somebody really, you fall in love and you want to share everything,
Hmm.
why did you come if it's not too personal?
Right. Going back to a lot of humans feel like they have to have a validation, maybe, I'm assuming. But just in my opinion, it's like, wow, a lot of humans still have to be validated. Like age is nothing but number. They say it take a lifetime of living to learn how to live. I don't know if it take a whole lifetime, but we learn something new every day if we're willing.
Mm,
But yeah, a lot of people seek for validation, just being a human, because I guess it's in us in a way, until
mm.
you learn or grow up a little bit.
What if it's not about validation? It's just about we love each other and we want to get married. Again,
Yes,
again, I don't have
that
no
part.
judgment about it.
Yeah.
I'm just
And
wondering.
that's how it should be. That's how it should be. Like whoever you love, you should be able to love. That's you expressing your creativity in the way you want to express it. Us being humans, we're supposed to use our brains. So it's like to see how the system works and how we're only taught to learn certain things. We all are supposed to be living off of goods and services, no currency, period. But like with us, learn as much as we can to share our knowledge with each other so we could come as one to be able to create. I mean, I thought it was that simple, but we see that this is the way of the world.
but
It sounds great.
I am going to say this, but you have to look historically. Marriage was never about love. It was a contract
Yeah,
between two families and the transfer, really the
correct.
transfer
Yeah,
of goods.
it's
So
true.
if you really go to like what it was originally about,
Hmm.
I don't know exactly where the romanticism of love came in. I think somewhere around the Victorian age. But when people actually start marrying for love, but families actually that's how they kept the family wealth was by
Economic.
making sure, certain families aligned to keep the
Hmm.
land and keep the wealth, quote unquote, amongst themselves, amongst the family. And so when I
Correct.
was a teenager and learned that, why do we have to get a license to get married? It's a contract. It's a
Hmm.
Hmm.
contract between two people. And still to this day, I still believe, yeah, it should be, there's love, but there's also the love is building upon, you're building something, you're creating something, you're
Hmm.
leaving something for the next generation to
Correct.
build up upon as well. So when you really learn the history, that's why I love Bridgerton. You'd be like, wait a minute, why are these people in society? Yeah, because they're bridging alliances together. They're
Right.
building wealth that way through
Hmm.
through that. So it's like when you think about it like that, you're like, oh,
Because
okay.
everything can be done
Yeah.
through a contract of an agreement that, this happens, you'll take care of this. You have an agreement, whether you are quote unquote married or not. There's the agreement that this person has to say so about this. This person has access to my money. This
Yeah, the
person has,
power of
yeah. So
attorney, you get a
it's
power of attorney and you have to make sure, yeah, power of attorney and it's a couple of other quote unquote names to make sure that documents you have to make sure you have in order. Because if you don't
Yeah.
have it in order, if anything happens to you or anything else, it's the next, what's the word? Next person
Next to
in your
kin.
family, next
Next to
kin.
kin.
Yeah.
Yeah, right.
Can y'all hear me?
Yes,
Yes.
Maggie. Yeah.
Okay, I'm on my cell phone, so I was trying to get through, but that's correct. It's all about the wealth also. And that's why back in the day, that's why they have arranged marriages. You know,
Mhm.
people wasn't marrying for love. They picked the person's spouse for them, and then they learned each other. But it's all about wealth transfer, having the proper documentation, because if you're not married and certain things, it could go to the next of kin. So
Oh,
it
baby.
really was about the wealth, holding on to the wealth. So that's just even like, okay, just say that the ex-person was married, right? Let's just say he was married, but you and this guy, y'all been in love, y'all been living together, y'all done built together, everything. But if that guy never got a divorce or anything like that,
Everything
even though
goes to his
y'all live
ex-wife.
together, everything go to the ex-wife. Like, it's just through the documentation thing,
Yeah.
legality.
Yeah. Yeah.
It's
Yeah.
that legality thing,
Mm-hmm.
right?
Look, that's extremely deep. I'm gonna try to make this real short. Like growing up, I was born in '89. We grew up in Oak Park. All of my friends were like Jewish or Chaldean and Arab. So my first black friends wasn't until I was a little older. But
Mm-hmm.
seeing how their family grew up, and all the families stayed together. They became one. Even if you got married, they all stayed in the same house. But it made
Mm-hmm.
sense because they all were able to do what they wanted to do because they didn't get kicked out at 18 or however you
Right.
want to put it. But yeah, just with hitting that, with documents, like if we actually go to the root of that, when you sign your birth certificate, if you actually took a magnifying glass and read the line that you're signing over, you're signing your child over to the government.
Yeah.
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 Any government check,
Mm-hmm.
if you actually took a magnifying glass, look at the endorsement, and then you will see that those are words because that's not even your money.
Mm.
You're
Mm-hmm.
right.
But it's just
Right.
That's
something to
that's
think
that part
about.
is right. Like, yeah, that part is right.
Mm-hmm. Mm-hmm.
Thank you for sharing that, Simone.
Yeah.
No problem. Look, I be
So
trying to
the
calm my down. I'm sorry.
yeah, the laws,
Okay.
right? The laws of the land and all that other kind of stuff, Yeah. It's a lot though. You just really have to know what you're doing. That's where that sovereignty come in at, but you got to know what you're doing because you can really hurt yourself, right?
Yeah, that's right.
Mm-hmm. Sharonda?
What do y'all think about this? I haven't watched the video, but Dr. Boyce, he said, what do y'all think about black people arranging marriages in the future?
I don't
Mhm.
think that's a good idea. I
I
mean,
mean,
no, heck no. I mean, if I had to go back, if somebody did that to me, telling me I got to marry somebody, I'm like, we're not even compatible at all in the least, I'd be like, no. But I know that I don't know if it's still in existence, but you know, besides the children and a husband got a wife and got somebody else they living with and all different kind of stuff like that. I know that consummation in and of itself, that if the marriage has not been consummated, it's not even a legal marriage to begin with. So you have to have sex with the person that you married in order for the marriage to be legal. And if you don't, then you can get out of it by a divorce very, very easy, as opposed to someone who has consummated the marriage and lived together and built a life together and have different stuff.
But it's interesting, so much in America here, we consummate. We ain't even thinking about marriage. We all over the place.
Sometimes don't even know the guy that
Right,
well.
Be
exactly.
consummated. And that brings a good point. Back in the Bible day, like the teacher was saying, they married for certain reasons, but like when Ruth
Mhm.
went into Boaz and she wanted him, all that she had to do was pull the thing over, they have sex, and they was married. And then look at the whole thing with Rachel and Leah. When one of them was promised to this man, he wanted to marry one of them. One of them had a crooked eye, he didn't want to marry him. But anyway, he married somebody else, and all he had to do was have sex with her. And he's like, when he went into her, he didn't realize that he wasn't getting the one that he wanted, and he had
Right.
sex with her, and it was too late. So he went back and he said, "Hey, this ain't the one you said you was gonna give me. What about, I think it was Rachel. No, Rachel was Leah. He wanted Leah." And then
Right.
he was like, wanted Leah. He said, "Yeah, you got to work another 7 years if you want Leah. You have to
Ooh.
deal with crooked eye Rachel."
Yeah, which king, I think it was king that had so many women wives.
Oh, wives and concubines. They had them
Yeah,
all. You
I'm
had
like,
sex
I
with
said, okay, so all you got all these women. So what happens if they meet somebody else and have sex with somebody else? Are they what?
they commit adultery because once you have sex with the man, you are his wife. I don't care if he have 50, 100 wives
Yeah,
and
that was so
20,000
stupid.
concubines. They all his as long as he can take care of them. That's the way they viewed it.
Well, he
Having
was a
sex,
Yes.
king, right,
Yeah,
right.
he had money. He can do
it
it.
was a hot
Mm.
Yeah,
back
but he
in.
can only do so much a day. What? He
I
can
don't know
only
how he
handle
did
so
it.
many.
I know with with Abraham and Sarah. Sarah got married when what's her name? This lady, what's her name? She had a
Yeah,
son named Ishmael. What was her
yeah,
name?
yeah, that's why they have the issues.
Yeah,
Yeah.
but I want to say if you was a wife or a concubine of a king back in the biblical days, there was certain attributes that you got, like a harem. People think that a harem was something where the women was just laid up and around the king. No, harems were places for the wives and the concubines to be protected from, was it war or, armies and different things of that nature. You was fed, you was clothed,
Right.
you had a dowry, you had riches, you had something worthwhile. You wasn't just there to be there. You had something worthwhile to be a wife and a concubine of the king. And I'll be honest, that's part of the problem what's going on with some of the men today. They ain't got nothing.
They ain't got
So how I'm
nothing.
gonna get with you and you ain't got nothing?
Nathan.
Nothing. No house, no car, no job,
Right.
nothing. So it's like, if you was a woman or a girl coming from a poor, like let's say a poor family, a poor situation, that was actually even to be a concubine was actually a honor because it gave your family money to help them get out of their poor situation
Right.
and you was living a life of lavish. So it may be 400 wives and you may only see your husband once a year to have sex with him, but you living a better life than what you would if you were still on the farm with your family.
Oh, good point.
Yeah. The
No, it's like
king
you got
took care of the kingdom. The
Oh,
king
King
took
was
care of the
playing
kingdom.
himself
He
pretty
was a
yep.
bad.
good king. You had good kings and a bad king. The good kings took care of the kingdom. They took care of the people.
Well, I don't
Yeah.
know. If I'm in love with somebody else outside outside of them 400 women, I would want to be able to
Exit
get
status.
so I mean there's the good and bad and all of that. I would not want my mama picking my husband. And I would not or my friend, I would not um yeah, I'm glad that we have the freedom to do that. And but I totally get the wisdom of families looking at it for
Wealth transfer.
generational wealth and for generational
Hmm.
children or even because some okay, we get to hair. I know we about finished. We get to hair and skin color. We as a people would marry because she's light skinned or she's too dark and they're in love with one another, but she's too dark or he's too dark. And then but pure love is going on. They can take care of it. So it was all kind of reasons why, I mean, even us individually, why we pick certain people,
Right.
certain types. I was telling Danielle when I saw a picture of John, I said, "You have a type." Yeah. All her boyfriends kind of look like that. I have a type. Each of us have one, a type that we are more attracted to than others, whether it be about money or
Intelligent.
personality. I looked up. I most of my guys were musicians.
Yeah. Yeah. Well, makes
Musicians.
sense.
Yeah, yeah.
That shows intelligence.
Mm. Well, you
Okay,
know
Sister
what?
Deitra.
We're actually coming on an hour. It's been a wonderful hour. I did for those of you who came in late, the topic today was courage through the surgical journey. And we talked about surgery, what comes out, what needs to take place during surgery and all that. Um, but then we went on a little tangent here, and it was good too. We talked about, marriages and things like that. But it was good. Good talk. Thank you all for sharing what you did. And if you please take a look at our archives because we recorded the whole talk. So if you want to know more about the topics today, please find out. Especially if you get surgery or anything, or you know someone that's getting ready to have surgery, find out what needs to be done. Is there anything else, Stacey, you want to share?
I would like to say one more thing. Sorry,
Oh no,
guys, I showed up
no, no,
late.
no.
I'm happy I made this whole meeting, and I want to say
Yeah.
again, happy birthday to all of you all. I love y'all, and have a beautiful day on purpose with purpose.
Oh, thank
Mhm.
Oh,
you.
that's sweet.
Madam Finance tomorrow. Get your money in order so we can marry the family who are rich.
Right.
All right.
Okay, well, let's give ourselves a hug.
Mhm.
Ooh, because we can love ourselves too, y'all.
That's right.
It
Mhm.
don't cost nothing.
Like, especially since it's our birthday.
Right, right, right. Okay, hug the world. Ooh, wee. Happy birthday, everybody.
Yes, thank you.
And let's sprinkle some goodness down. Ooh, yay. And may you all have a wonderful day. And we'll see you next week or tomorrow, rather.
All right. Peace out.
Peace out.
Peace.